Okay, so these days I get some chats from couples that have been trying to conceive for a while now. Like that some of these couples, you go to Google and then you start googling your problems. What are the things I need to take? Okay, what are the medication? You just start googling the food you need to eat, the medication, the drugs, the things you need to do to get pregnant, all those things. It doesn't work that way. Okay, Google is not a doctor. I've always been saying this. Google is not a doctor. Go to the hospital, see a doctor. Okay, there are specialists that takes care of that. Okay, that specializes on fertility. Okay, so you just go to see a gynecologist, see a fertility expert. Okay, so tell your problems to these professionals. Okay, so they will look for a solution. Okay, after a proper interview with you, okay, thorough interview investigation. Okay, so at the end of the day, we'll suggest some tests, prescribe some tests for you. You go run it. Okay, and then we'll look at what are those, where is really the problem, where is it coming from, then we'll find solution to it. Okay, if you're a man, okay, we'll get your sperm, okay, for semen analysis. We'll look at your sperm counts. Okay, if it's actually low. Okay, so we'll also look at all those things. Then we'll look at how healthy your sperm is. Okay, is your sperm able to fertilize the egg? Okay, so we'll look at all those things, and also your lifestyle, what you're eating. Okay, if you're a smoker, okay, if you drink alcohol, okay, those are drugs. Okay, that some men take. Okay, we'll examine all those things. Okay, where the problem is actually coming from. Okay, so then we'll also look at your reproductive organs. Okay, especially testes. We'll look at the testes, we'll look at the epididymis. Is there any obstruction, okay, on any of those tubes that carry sperm, on the tube that carry sperm from the testes down to the urethra where you ejaculate. So we'll also look at all those things. Okay, and then if you're a lady, okay, if you're a lady, we'll check your hormonal profile. Okay, we'll do an hormonal profile test for you. We'll look at, okay, are your hormones balanced? Okay, we'll look at the follicle stimulating hormone, the luteinizing, the estrogen. Okay, those prolactin. We'll look at all those hormones, are they balanced? Okay, because if there's any deviation in any of those ranges, okay, either high or low, it's going to affect your fertility. Okay, we'll also look at, okay, we'll do a scan for you. Okay, do a scan for you, look at your reproductive system. We'll look at your reproductive organ. Okay, starting from your vagina down, the cervix, the uterus, the fallopian tube, the ovaries. Okay, we'll look at, is there anything like fibroid, okay, that is trying to, that is affecting your fertility. Okay, we'll look at your fallopian tube, any obstruction, any cyst. Okay, okay, so all those things will be examined. Okay, do you have any chronic infection, like the pelvic inflammatory? Do you have any chronic, all those things we'll look at. We'll examine you at the end of the day, so there will be a solution. Okay, so there will be a solution. It's quite better than you ordering a product online and then you start taking without doing any test. Okay, and then you will also be counseled on your menstrual cycle. Okay, your ovulation day. Okay, when you should actually meet your partner. Okay, how frequent. Okay, so we'll look at all those things and then we'll counsel you, we'll guide you, and then you'll be guided, and then there will be a solution at the end of the day. Other than you going about in the internet looking for a solution, you cannot get your solution online. Okay, you cannot get it on the Google. Okay, so speak to a doctor. That's what I've always been saying. If you have a problem, go to the hospital, see a doctor. You'll be properly examined. Okay, some investigations will be done. Okay, some tests will be carried out. Okay, and then at the end of the day, we'll arrive at the solution to your problem, give you some medication, look at your system, give you medication. Okay, that will actually work for you, counsel you on the side effect, when you should take it, all those things. Okay, so if you have such problem, please go to the hospital. If you are couples that you're trying to conceive for a while now, okay, whether you have a kid already and then you want to have another one, okay, you are not able to conceive. Okay, please go with your partner. The two of you should go to the hospital and see a doctor. See a doctor, understand? Okay, all right, thank you.